Do14 is on the posterior midline, below the spinous process of C7 in a depression. Do4 is on the posterior midline, below the spinous process of L2. Bladder 11 is 1.5 cm lateral to the posterior midline, below the spinous process of T1. Going to find the inferior border of T1 and come directly lateral to it on the height of the paraspinal muscle.
Small intestine 13 is located in a depression superior to the medial end of the spine of the scapula. It's about 1 cm medial and slightly inferior to small intestine 12. Palpate along the superior border of the spine of scapula until you find a nice dip at its medial end. Be careful that you don't palpate too far, because you will fall off the scapula and find another dip, but it's not small intestine 13.
Bladder 54 is on the buttock, 3 cm lateral to the sacral hiatus. Typically, if you put your hands on the sides of the buttock, it is midway between the sides and the gluteal fold at the midline. Gallbladder 30 is in the posterior lateral aspect of the hip. It's at a junction from the anterior 1/3 and posterior 2/3 of a line taken from the prominence of the greater trochanter and the sacral hiatus.
Gallbladder 21 is located midway between Do14 at the base of C7 and the lateral extremity of the acromion process, but at the crest of the trapezius muscle. To find the crest of the muscle, it may be necessary to dip down slightly to make sure you get the highest part. This point forms a line with Sanjar 15 and small intestine 13. Gallbladder 21. Small intestine 14 is located 3 cm lateral to the inferior border of T1. Locate your T1, move 3 cm laterally. The 3 cm at this level is dictated by the medial border of the scapula. Small intestine 12 is located directly superior to small intestine 11 in the suprascapular fossa. To find this fossa, palpate along the spine of the scapula and find this nice dip that lays superior to it. Once again, it's important that when you mark points on the shoulder, you're actually working parallel to the part of the body you're marking on. Large intestine 16 is located on the superior aspect of the shoulder. It's in a depression which is medial to the acromion process. It's medial to the lateral extremity of the clavicle and the spine of the scapula. Palpate to find a nice dip. This point isn't on bone, it's in a nice dip. Sanjiao 14 is located inferior and posterior to the acromion process at the origin of the deltoid muscles. The easiest way to find this point is to take the weight of the person's arm and palpate in between the heads of the deltoid to identify the anterior, lateral and posterior heads of the deltoid. If you push forwards, you should be able to feel the bony extremity of the acromion process. Sanjiao 14 is inferior to the acromion process in between the posterior and lateral heads of the deltoid. It forms a nice curved line along the edge of the acromion with large intestine 15 and small intestine 10. Large intestine 15 is located anterior and inferior to the acromion process at the origin of the deltoid muscles. The easiest way to find this point is to take the weight of the person's arm, extend their arm and palpate for the clefts between the anterior, lateral and posterior heads of the deltoid. If you push medially, you should be able to feel the bony extremity of the acromion process. You need to locate this point inferior to the acromion process between the anterior and lateral heads of the muscle. Mark this point when the arm is then relaxed. Small intestine 10 is located on the posterior aspect of the shoulder. It's directly superior to the posterior axillary crease and inferior to the lateral extremity of the spine of the scapula. Find small intestine 9, come straight up, feel for the spine of the scapula and then come back down into a nice dip to find this point. You're not on the bone and you're not on the deltoid, you're in a nice dip. It's important to remember that to find this point accurately, you need to be standing parallel to the part of the body that you're working on. Small intestine 9 is located on the posterior aspect of the shoulder, about 1 cm superior to the posterior axillary crease. How do you find this 1 cm? Well, it's important to place this point inferior to the inferior border of the deltoid. To bring this into relief, the person can push their arm backwards. You're feeling for a nice soft area below the muscle. It's important to remember that when you finally locate this point, you need to be completely parallel to the part of the body you're working on. Small intestine 9. Liver 2 is located half a cm proximal from the edge of the web margin between the first and second toe. The easiest way to find spleen 9 is to palpate gently up the medial crest of the tibia until you fall into a nice depression formed by the medial crest of the tibia and the inferior border of the tibial condyle. This point's in a depression. It's not on bone, it's not on muscle. It's in a tender depression. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Stomach 35 is located on the lateral aspect of the knee when the leg is flexed. It's on a level with the inferior border of the patella and lateral to the patellar ligament. Stomach 34 is located 2 cm superior to the superior border of the patella on a line joining the lateral aspect of the patella to the anterior superior iliac spine. As the patella itself is 2 cm long, we can use this measurement to help find this point. Another useful tip is to have the person press their leg down into the bed. This point will be found in a nice cleft at the inferior border of vastus lateralis. Gallbladder 34 is located in a depression which is anterior and inferior to the head of the fibula. To locate the head of the fibula, find the tibial tuberosity and move laterally until you find a prominent bony landmark. Be sure that you don't confuse the head of the fibula with the lateral condyle of the tibia, which is closer to the kneecap. Stomach 31 is often described as being at the junction of a vertical line drawn through the anterior superior iliac spine and a horizontal line drawn through the greater trochanter. More importantly, it lays on the lateral aspect of the muscle sartorius. To bring this muscle into relief, have the person cross their legs. It should now be possible to palpate over sartorius and find a nice depression lateral to it. When the person brings their leg back to a resting position, you will find that this point may not lie exactly on where those two lines join. Bladder 40 is located at the midpoint of the popliteal crease, in between the tendons biceps femoris and semitendinosus. To bring these tendons into relief, get the person to take the weight of their own leg. It then becomes quite easy to feel these two tendons. It's also easier to see where the popliteal crease lies. When they lower the leg, make sure you mark this point directly in the centre of the popliteal crease. Bladder 36 is located on the posterior median line of the leg in the transverse gluteal fold. Find bladder 40, travel up the posterior median line of the leg and find a depression in between the two hamstring muscles in the transverse gluteal fold. Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone.
Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine 10 is located 10 cm proximal to large intestine 5 on a line heading towards large intestine 11. Palpate along that line and fall into a nice groove in the muscle at 10 cm. Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed.
Sangel 10 is located 1 cm superior to the tip of the olecranon process of the elbow. The point is found with the arm flexed and the hand supinated. Small intestine 8 is between the olecranon process and the medial epicondyle of the humerus. Make sure you don't have the arm fully flexed for this point because it will be impalpable.
Lung 7 is located 1.5 cm proximal to lung 9. It's located just a little lateral to the main line running from lung 9 to lung 5 in a cleft between the tendons of abductor pollicis longus and brachioradialis. It's located just at the base of the flare of the styloid process of the radius. In this position, the point is just about visible on the corner of the arm. If you locate the point too radial, it's falling onto the yang surface of the arm. Lung 5 is located on the transverse cubital crease in a depression which is just radial to the aponeurosis of biceps brachii. This point has a nice, soft, swampy feel to it. Be careful to not go too radial and to fall onto the tendon of brachioradialis.
Pericardium 3 is on the transverse cubital crease, immediately ulnar to the aponeurosis of biceps brachii. Heart 3 is at the medial aspect of the elbow, midway between the medial epicondyle of the humerus and pericardium 3. So coming midway between those 2 points and the medial aspect of the transverse cubital crease.